change is probably a bit strong, but this video actually is a game changer. It's the first officially approved antiviral. Now, we've got a lot more to say on antivirals and the background to this, but I just want to focus on the information that we have so far. Now, this is on this new medication here, the Merck new medication called molnupiravir. Now, let's just look at where we get this information from. Now, I don't like science by press release. We need science by peer-reviewed literature, but we haven't got it yet. We will soon, but we haven't got it yet. So we've got this press release from Merck and Ridgeback. Investigational oral antiviral molnupiravir. And great claims are made for it. And these do seem to be substantiated. Now, we have to stress this is not substantiated by peer review yet, but a company like Merck wouldn't release this until they were fairly sure about what they were talking about. So let's look at what they're saying. So this is Merck in combination with another group called Ridgeback who brought this out. Now, this is an oral antiviral. Now, of course, we have the monoclonal antibody therapies that are used at the moment. But these can be given shortly after diagnosis in the first week of the illness, preferably in the first day or two of the illness, in the viral stage, before the inflammatory problems have arisen, while it's still the virus that's the primary pathology. But they have to be given in hospital, they're expensive, they have to be given intravenously. Whereas this is potentially a very simple, straightforward oral preparation. So it's the first oral properly recognised antiviral. Now, this is huge. I mean, having worked in healthcare for 40 years, we've always dreamed about an antiviral. Now, some antivirals did come out for herpes simplex virus, like for cold sores, the acyclovir, and then some antivirals came out for against retroviruses, the highly active antiretroviral therapy for HIV. But apart from that, we really don't have much in the way of antiviral therapy. So this is a big step that this is now officially being officially recognised. So it's an oral antiviral. Molnupiravir, this is the code name for it. No one really, I don't know what these stand for. They're just code names given by the pharmaceutical developers. Now, there's a positive interim analysis of a phase 3 study. So what they've done here is, rather than let the study run for the whole duration, they were convinced by the results, and they've actually terminated the study, because the idea here is that if something is very effective, it would be unethical to carry on giving people a placebo, which I agree with. That makes sense. Now, they're saying significantly reduced risk of hospitalisations or deaths. Of course, we welcome both. During day 1 to 5 to 29. Now, what I mean by this is people were recruited and they were allowed to start the treatment if they were the first, second, third, fourth or fifth day after they developed symptoms. So in other words, this was in the viral phase of the illness. It'd be no good giving this in the second week because it's an antiviral. It's got to be given early to reduce the viral load, to reduce the likelihood of the inflammatory complications that can cause death in this, and severe illness and death in this condition. And then they followed the patients through for 29 days, which seems pretty reasonable. So it's called the Move Out trial, phase 3. Now, they took at-risk, non-hospitalised adults with mild to moderate COVID-19. This is who they recruited. So it's a global phase 3, randomised, placebo-controlled, double-blind, multi-centre study. Excellent, that's the ideal clinical trial. And I strongly suspect that when we get the peer-reviewed literature on this trial will have been impeccably carried out, because there's big pharmaceutical companies involved and there's a lot of money at stake, and they will want to get it right. So it's non-hospitalised patients to prevent people getting hospitalised. And it was carried out basically all over the place, all those countries. So multi-centre international study. This is research really at its best, as they can coordinate. Eligibility criteria for the study: who was allowed to get into it. Laboratory confirmed mild to moderate 19, of course, all completely confirmed cases. Symptoms onset within 5 days of study randomisation, so the first 5 days of the illness in the viral phase. And all patients were required to have at least one risk factor. So one risk factor such as age, hypertension, obesity, heart disease, lung disease, immunocompromised, something that would make them more at risk, more at risk of being hospitalised. And the results are pretty good. basically a 50% improvement. This is the molnupiravir group. Hospitalised or dead, 7.3% of the patients. Remember, these are patients with at least one risk factor. In other words, hospitalised or died 28 out of 385 patients. No deaths in this group. Very good. Treated with molnupiravir. You can tell antivirals, they got vir on the end. Placebo group, completely randomised, of course. So this is good stuff. Hospitalisations or dead, 14.1%, getting on for double. That was 53 out of 377 patients. And the probability that that result arose by chance is p equals 0.0012. In other words, there's only a very, very small chance. This is the highly significant result. That wouldn't arise by chance. And placebo group, well, there was 8 deaths in the placebo group, so pretty convincing, actually. About a 50% reduction in hospitalisation and perhaps even more significant reduction in deaths, as long as it was given in the first week of the illness. Data Monitoring Committee on consultation with the FDA in the United States. Recruitment to the study stopped early, which is good because it was working so well. Due to these positive results, Merck have applied for emergency use authorization in the United States and all around the world, including the British authorities and the European Medicines Agency. And they are in consultation with many governments around the world and are in consultation with governments that they haven't yet made agreements with. So this is going to be a huge international rollout. I'm pretty sure the approval is going to be given within a few weeks and people will be taking this drug within a month. So this is happening pretty soon. FDA dependent, of course. But of course, will the European Medicines Agency or the British regulatory authorities act first? That's still possible because they've been recruited into this as well. Now, they evaluated data on 775 patients, which is a reasonable sample size. Now, they were planning to recruit 1,550 and they recruited 90% of that already when they paused it. Molnupiravir reduced risk of hospitalisations and death across all key subgroups, which is important. So different people with different risk factors, whether it was obesity, hypertension, heart disease, lung disease, renal disease, whatever it was still effective at reducing hospitalisations, which is encouraging. Efficacy was not affected by the timing of symptoms or the underlying risk factor, so it looks like it was working any time in the first 5 days. Now, we're not sure about that, of course, because this is all the information we have. The information we have here is pretty limited. As I say, it's basically a press release, and I've just tried to get as much out of that and make as much sense of that as possible. About 40% of patients had sequencing data to show them what variant of the virus they have, and molnupiravir demonstrated consistent efficacy across viral variants, gamma, delta and mu. And of course the mu is the one that might be somewhat vaccine resistant. The delta one is the one that we know, of course, is everywhere. So looking like the antiviral spectrum of properties is good across all of the variants equally. And that does make sense when we look at the way that this drug is working. Incidence of adverse events between groups. Now, this is going to be critical. How safe is this drug going to be? Now, there was very limited data on this, but I think we can assume the FDA and the regulatory authorities have been given full information. And from what we hear, it's going to be a reasonably safe drug. But let's look at what we know from the press release. Incidence of adverse events in the molnupiravir group, 35%. But incidence of adverse events in the placebo group, 40%. So not significant difference between the two groups. You can see why it's so important to have two groups. Drug-related adverse events in the molnupiravir group, 12%, 11% in the placebo group. In other words, these weren't real. It was generated essentially by the mind of the individual. So basically, again, not statistically significantly different. Subjects who discontinued the study therapy due to an adverse event, well, in the molnupiravir group, 1.3% felt they had to discontinue taking the medication. In the placebo group, 3.4% felt they had to discontinue taking the medication. Merck said data shows molnupiravir is not capable of inducing genetic change in human cells. Now, this is not from the press release, but the concern is, and I'm not too concerned about it myself, but it's looking like it's going to be okay. But the way this drug works is it interferes with the RNA replication of the virus. And some people are concerned that it could interfere with the viral replication, or with the DNA replication rather, in human cells. But Merck here has said, and this is actually in what they said to Reuters rather than this press release, as Merck said, data shows molnupiravir is not capable of inducing genetic change in human cells. So it messes up the genetics of the viral cell, kills the viral cell, but not the human cells. So in other words, is this a silver bullet? Does it only kill the virus? It's looking that way. But men enrolled in trials had to abstain from intercourse or agree to use contraception. They didn't want people's sperm fertilizing ovum when they were on this medication. No reason for that given, but this is just what we know so far. Reuters report said women of childbearing age in the study could be pregnant, also had to use birth control. Now that's what they said, so I put the not in there because I think they've just missed it out. So basically they don't want to give this to pregnant women, and this is not necessarily a warning sign. This is just reasonable caution until more data is gathered. We can keep this out of the reproductive processes until more information is gathered. About Merck's effort to enable access to molnupiravir if it's granted emergency use authorization or approval, which I'm expecting it will be fairly soon. Merck has been producing molnupiravir at risk. In other words, they're making a shed load of it, but if it's not given approval, they'll lose their money. Merck expects to produce 10 million courses of treatment by the end of 2021. 10 million courses, which would be a good start. Existing procurement agreement with the United States government they have. And the agreement is Merck will supply approximately 1.7 million courses of molnupiravir to the US government upon EAU approval. Now, as I said, there's more background to talk about this now, but in this video, we're just talking about what we know from the press releases and other press sources, which is all we have at the moment. And as I've said, that is encouraging. Now, what they didn't seem to have space for in the press release was the cost. $700 for a 5-day course, we believe. I think it works out at about $705. It's 2 doses a day, so I guess that's working out about $70 a capsule. And that's based on $1.2 billion purchasing agreement from the United States government for 1.7 million treatment courses of molnupiravir. So a course is 10 capsules, BD, 2 capsules a day for 5 days. And that's going to cost $700 a course. This is huge potential income, clearly. Other antiretrovirals are other antiretrovirals we have. This is an antiviral. SARS coronavirus 2 is not a retroviral. I misspoke there. So other antivirals are on their way from Pfizer and other companies. So this is just the first to be officially recognised. So, but not cheap. Merck, but news maybe getting better. Merck supply and purchase agreement with other governments worldwide. That's happening. They're also negotiating with other governments at the moment. People are going to be queuing up for this stuff, I would imagine, fairly soon. Plans to implement a tiered pricing approach based on World Bank country income criteria. So it's going to be cheaper for poorer countries, which is good. Company has entered into non-exclusive voluntary licensing agreement for molnupiravir with established drug manufacturers, particularly in India. Generic manufacturers to accelerate availability of molnupiravir in more than 100 low and middle income countries. So let's hope they come good on this boast. But that's what they're saying so far. Also on this study, the most common risk factors for poor disease outcome included obesity. So these were kind of side effects really, but people with obesity didn't do so well in either category. Older age didn't do so well, diabetes mellitus didn't do so well, and heart disease didn't do so well. So nothing really new there, but it is interesting to sort of carry on with that data. Any extra evidence is always useful. Now, this is about molnupiravir now. So it's investigational, it's being investigated, orally administered, not IV, the same as the monoclonal antibodies. And it's a form of ribonucleoside analog. So the ribo is the sugar part. These are the nucleic bases that make up the RNA. So basically what this does is it pretends to be one of these bases with its sugar. But it actually inhibits the replication of SARS coronavirus 2 ribonucleic acid. So it's a bit like a sort of as far as I know, we don't know a lot yet, but it seems to be a bit like a sort of a Trojan horse. It's like one of these ribonucleosides, but it actually isn't. It actually goofs up, messes up, interferes with the whole process. Like, I guess I will call it an antagonistic effect. So it inhibits the replication of SARS coronavirus 2. That's the way it works. Several preclinical models of SARS coronavirus 2 and includes, so this looks like it could be effective for prophylaxis, preventing the infection, early treatment of the infection, and also reducing transmission. So it looks like it could have activity in those 3 areas. They're also conducting another study called Move Ahead, which is a global multi-center randomized double-blind controlled placebo-controlled phase 3 study. Good. And that's evaluating the efficacy and safety of molnupiravir in preventing the spread of COVID-19 within households. Well, that was the bit that I found about the cost of this, the cost of the medication, the Biden administration announcement. It's actually in there. Obviously, I put the link there, but here we are. On the 1.2 billion purchase agreement for the 1.7 million 5-day treatment courses of molnupiravir. So not remotely cheap, but it's the first one. So there we go. Now, as I say, more critique of that at the moment. That's just a quick review of what we know. We've been waiting for antivirals for a long time. Antivirals are potentially a complete game changer, because the allergy I like to use is bubonic plague. You know, the bubonic, the Black Death that first came to England in 1348, and there's been outbreaks. The plague of Justinian back in classical times was this same bacteria, Yersinia pestis, that causes the Black Death, and there's been outbreaks. There was a big one in my country again in 1665. Just before the Great Fire of London in 1666. And anyway, so there's been outbreaks of this all the time, and there's outbreaks as well every year in India, China, quite a few places in the world, but it's not a problem because we treat it with antibiotics. It's eminently treatable. That cures the patients as long as we catch them early enough. They're nearly always cured. If they become septic already, then they're probably going to die. But as long as we catch it early enough, we treat these patients. But because we treat the patients, we kill the bugs. Therefore, the bugs don't spread. So an antiviral really could be an effective antiviral could really be the holy grail that, if properly implemented and distributed, could halt this pandemic really quite quickly. And of course, shares in companies making antivirals have gone up, and shares in some vaccine producers have gone down, because if you've got brilliant antivirals, you might need less vaccines. Now, at the moment, of course, we're encouraging the vaccination programme. This is going to be a useful additional weapon in the arsenal, reducing hospitalisations by getting on for 50%, which is good news as we await further data. Now, as I say, more on antivirals later, but that's the news on that one for now. So thank you for watching, and antivirals are coming, and they will be massively significant, not only for this, but imagine we had a generic antiviral that was really effective against all RNA viruses. Then another RNA pandemic came up, we could clobber it at source, and the pandemic would never arise. And people are working very hard to recognise drugs that might be effective as antivirals and develop new antivirals as we speak. So this is promising, and I'm hoping, as we've said, these are going to be implemented within the next few weeks. So thanks for watching this video, and stay tuned for more comment on this and other antivirals shortly.